And I'm joined now by Dr. John Brownstein for more on the effects of daylight saving. Good morning, Dr. Brownstein. Getting an extra hour of sleep sounds awesome. So what's the problem?
Yeah, morning, Diane. So changing the clock is actually something that many of us dread, and for good reason when it comes to our health. The American Academy of Sleep Medicine just released a paper calling for a permanent change in time to springtime. So that's because it more closely aligns with the rhythms of our body clock. And actually, a recent NIH study showed about 150,000 Americans are affected by this change in time. And so while there's historically, value in energy consumption, there's real impact on things like cardiovascular disease, stroke, workplace injuries on the Monday after the time change, fatal crashes. Not only that, there's impact on mental and behavioral health. We're even seeing actually the impact on infectious diseases and inflammatory conditions. So there's a real benefit in thinking about the long-term consistency of removing the time change. Needless to say, it's worth thinking about a national policy change here.
And if you don't have to do it in the fall, then you also don't have to do it in the spring. So even though now we think, but I'm getting an extra hour of sleep, it means you don't have to lose an extra hour of sleep when we do it in the springtime.
Exactly.
And this has already been a really difficult year. Now we're bracing for a second wave of the pandemic, holidays where we may not be able to see our families. How can people prepare themselves for the time change and the literally dark winter ahead in all of this context?
Yeah, really, it's a concern. We have this collision of a pandemic and the dark days of winter, so we have to be so incredibly vigilant about our health leading into these months, right? So there are small changes that we can make, and they all really relate to our sleep and nutrition. So, of course, as we heard in the previous piece, gradually impact bringing this time change, so not just doing it all at once, but also grabbing that extra sunlight. An extra 20 or 30 minutes outside can help cue your body clock, and that also brings vitamin D, and we know vitamin D can help fight infections like COVID. You got to watch what you eat, as always. Lay off the caffeine. Daylight savings can actually bring carb cravings, so you got to avoid that overeating, especially those fatty and spicy foods that can bring insomnia. So you got to eat lightly. That's a good advice generally. We got to avoid those bright lights. Department stores, grocery stores, they can help impact your sleep. Also, technology. Clearly, if you can start to get rid of that technology late at night, that will help your sleep as well. And then finally, you need to be aware of sort of mood changes, right? We have seasonal affective disorder, a type of depression that relates to the change in season. That's going to be as big a problem this year as any year we've seen. So between less sunlight, stress around the virus, the economy, we have to be so hyper-focused on our mental health in these next few months.
All right, good tips. Dr. John Brownstein, we appreciate your time this morning as always. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.